Kia ora koutou, ko Tim Chambers tuku ingoa. Thank you for all being here today. I thought I'd pitch my talk around the work that we've been doing in the environmental epidemiology space around drinking water quality and health. But before I jump into that, I'd also say that I've spent the last sort of 10 or so years in the high performance program for New Zealand water polo. And so if any of you have any interests in doing research projects looking at that high performance environment, then I'd be happy to facilitate that relationship. Because there's a lot of research questions that we want answered, and that I think that we could try and utilise the resource that we have here at the university. I'm also the head coach at Christchurch Boys High School, so if you're interested in community sport and school sport, then also in that space as well. So my work most recently has been focused around drinking water quality and health. And we know that having access to clean drinking water is a fundamental human right and really, really important for our overall health. We also know that in New Zealand that there are major consequences of contaminated drinking water. We found this out the hard way in Havelock North, where we had an entire town get sick and 4 people died as a result of a contamination event. We also know now, especially with the data coming out, that we've got major challenges ahead of us in terms of the water sector, forecasting $120 to $185 billion deficit in water infrastructure. Unfortunately, the deficiencies that we have in the physical infrastructure, our pipes, our treatment plants, are also reflected in the data that we have about these assets as well. And so as a result of that, we don't know a lot about the health impacts of contaminated drinking water in New Zealand, and also how to solve this. So this here is my tap in Lyell Bay before I moved to Canterbury last year. And so this is just one example of one of those deficiencies in reticulation. So this is from a pipe outage. So essentially when a water system gets shut down to fix a pipe, then contaminants can get in, and this is the result. And usually there's like a tweet or something from the water services provider telling you to flush your taps. But we don't really know how to quantify the health risk of these because the data is so bad. So what I thought I'd do is I'll sort of briefly talk you through the core data infrastructure that we've been compiling over the last 4 or 5 years to try and investigate some of these research questions, and then run you through a couple of the projects that we've got funded at the moment that are looking at different aspects of the water sector. And so what we've been doing over the last few years with colleagues at the GeoHealth Lab has been trying to create this data infrastructure. And what you can see in the top left there are the water distribution zones. So those are the areas that are served by any particular water supply. And so to get information on those, we had to go to all of the 67 different water suppliers, the councils, and request spatial information from them. We got very different information from all of them. Some of them had pretty polygons like this, which were pretty spatially accurate. Some people just sent us a snippet, from the snippet tool on Google Maps with a red outline saying, we think the water goes to this area. We also had people that had just huge areas of land. They say, well, our pipes are in this area and some of it goes to farms, so we're just going to say everybody's supplied here. So we went through a process of trying to standardize all that information, and we used information about building footprints to try and condense that. But that's just one example of sort of the challenges that we face. Same here with the pipes. So the nice picture of the green and red is just showing Invercargill's water supply actually and the quality of the pipes. Oh, that one there's showing the materials, but we got information about every single pipe length in New Zealand now, about the age of that pipe and the material that's used to be able to try and see the condition of it. And then probably the most challenging aspect, down there you see all those PDFs. So at the same time that we asked for spatial information about where the water went to, we asked for information about the quality of that water. And what we got in return were 3,000 PDF files that look like that, and 300 bespoke Excel files, all different formats and structures and not even uniform within the same Excel file. So I first put that request out in 2021, and we've almost cleaned 3/4 of it. But what we have cleaned has allowed us to then link these data sets to large national health data sets. So on the right there, the main projects that we've been doing have been using the integrated data infrastructure. Have you all heard of this database? Essentially, it's all routinely collected government information that's all linked at the individual level and anonymised, which can be made accessible to researchers for public good. So what we've been able to do there is essentially all of your health information, housing information is all in there at the individual level, and you can develop these large retrospective cohorts really easily and do studies in New Zealand that you can't do elsewhere. And then I'll talk through some of these other data sets as well as I go through these projects. But I thought I'd just run you through 3 of the main projects that we're working on at the moment. One of them is looking at nitrate contamination, which is an agricultural runoff, and drinking water supplies and preterm birth risk. And so for this study, what we've been doing is I've got every single birth from 2008 to 2021. We've been able to link that pregnancy to a water distribution zone and then quantify the level of nitrate during that pregnancy. And the advantage of having it in the IDI is that there's information about the mother's smoking status, BMI, age, ethnicity, parity, every other kind of risk factor that you'd want to try and include in that analysis. And so we've combined that with our national exposure assessment to try and look at this relationship between nitrate and preterm birth risk. And while we're just working on finalising the results now, our results suggest that it is associated with preterm birth risk and at much lower levels than the current drinking water standard, which will have implications for both potentially where that drinking water standard is in the future and then also how we use our land. And by doing that, we've been able to facilitate additional projects. We've got 2 PhD students, Hannah and Isaac, that are both looking at different health outcomes related to nitrate. So Hannah's looking at congenital anomalies, which are birth defects, another pregnancy outcome, and then Isaac's looking at the relationship between nitrate and drinking water and colorectal cancer. And Hannah's using the IDI, and Isaac is using a case control study that already exists on bowel cancer. One of the other programs of work that we've been looking at is the relationship between drinking water quality and enteric disease, so sore tummies. And what we've been doing is we've combining the drinking water quality information with our notifiable diseases. So in order to be in the notifiable disease register, you essentially have to feel sick, go to the GP, give a sample, and then get that tested and then get it classified as one of these notifiable diseases. And in order to look at this relationship, we've used this sort of study design called a case crossover. But it's quite fun because each one of the person, for epidemiologist, but each person serves as their own control in this situation. So what we have is a person starts getting sick, and then we look at the water quality before that person gets sick. And this is the case period. And then we control the quality of that, we compare the quality of that drinking water in that period compared to other periods that wouldn't be related to that person getting sick. And then you can try and tease out the relationship between drinking water quality and enteric disease. And Brittany, who I think is in the other room, because I told them to go watch Vincent's presentation, but she's talking later on today. She's doing her master's, and she's looking at the relationship using that study design between drinking water outages and enteric disease. So like I showed you before with the mug of dirty water, she's essentially looking at the relationship between that and enteric disease using outage data that she's collecting from the water suppliers, councils, and the enteric disease information. And then the last project that we've been doing a lot of work in is community water fluoridation. And so we've been able to use all of the information about drinking water quality to get fluoride information and then look whether or not water suppliers have been dosing the water to the optimal fluoride level. And what we found is that about half of the time they're not. So where we think a place is fluoridated, it's not been fluoridated to the optimal level for oral health, which means that it's not been fluoridated. Which means that a lot of the studies that we've done here in New Zealand that assume that because you're on community water fluoridated supply, it's actually been fluoridated, means that we're probably underestimating the likely oral health benefits of community water fluoridation. And so what we did is we mapped out where all of the different water distribution zones here that have been fluoridated and will continue to be. They're the ones in green. We've got the ones in purple, which are currently not fluoridated and never will be. And then we've got some yellow ones which have been told that they have to fluoridate by the Director General of Health. So they're starting their fluoridation. And the nice thing about this, again from a perspective of an epidemiologist, is that we have this nice controlled quasi-experimental design opportunity where we've got places that have always been fluoridated, will continue to be fluoridated, which we call like positive control, places that have never been fluoridated and won't be, negative control, and a whole bunch of intervention sites. And what we can do is we can link all of this information in the IDI to children's health outcomes to look at what their impact on oral health would be of this policy implementation. And this is just another slide of showing this how we did. So I said about half of the time they're not fluoridating. This figure on the right here is just showing the person years at different doses of fluoride. So where you want to be for fluoride is in that blue zone, optimal range. And so any bar that falls outside of that optimal range is showing that we've either had suboptimal fluoridation or a little bit too much, but most of it's suboptimal. So it means the majority of time people are not getting water that's fluoridated to the right amount, and that has implications for our oral health. And I'm going to keep it short. That's just a brief overview. I guess my sort of takeaway would be that if you've got any interest in any of this drinking water quality information or future studies we could do, we've got massive and really good data infrastructure now to do those studies. So I'd be really happy to talk about that. Or if you want to talk about water polo, also very happy to do that. Okay.